Awesome. Okay. All right. Well, in lieu of today's meeting, since the Zoom was canceled, we wanted to still have Greg Bradbard present on the impact of the federal health policies that are happening. So we're doing a little recording to send out to all the Inland SoCal Housing Collective members. So that way we can have an overview and some actionable items to move on, since everything is relevant and current right now. So Greg, thank you for still being down for this, and go ahead and share this great information with us.
All right, thanks so much, Melanie. And hi, everybody. Thanks for doing the pivot. Hopefully you can still watch this afterward. There's a lot happening right now in the healthcare world on both the federal and state fronts. So have some great information to share with you. Hopefully it's really helpful. And of course, feel free to reach out to me afterwards if you have any specific questions. So with that, I'm going to jump in and share a little bit of background for those of you who might not be as familiar with or just need a refresher on what is the difference between Medicaid and Medi-Cal specifically, and Medicare, as a matter of fact. And so this slide talks about what is the difference there. Medicare, we know, is for seniors primarily. It's for those over 65, and also for certain people with disabilities and some other special needs. Medicaid, on the other hand, which is referred to as Medi-Cal in California, just to confuse us, Medicaid covers primarily low-income people and children, but also includes some seniors and those with disabilities as well. You also might know that some individuals actually are Medi-Medi, or they have both Medicaid and Medicare. And those are seniors who have additional disabilities, where the Medicaid piece can actually help to cover some of the costs of Medicare. A couple other differences there. Down at the bottom, you see Medicare is federally administered, whereas Medicaid is jointly administered by the feds with the states. And from a tax standpoint, Medicare is funded through two trust accounts, whereas Medicaid is jointly funded through taxes, essentially through both the federal government and the state government as well. So it takes both to make that happen. You know, as we talk about this from a political standpoint, the question is who's supportive of Medicaid? And the research says Medicaid is really a bipartisan issue. It's a priority across party lines. You can see this study that says, you know, both Republicans and Democrats, when we're talking about the general population, are generally supportive. So 87% of Democrats and 63% of Republicans have a favorable opinion of Medicaid. And I want to share, as a matter of fact, this morning, I got some information that there was a new study that was conducted by the University of Chicago looking at a couple of districts across the nation. In particular, they looked at District 41, which is the congressional district of Ken Calvert, who you know is one of our local representatives in Riverside, who's also a Republican. And that's somebody in particular whose vote is really important on this. And they did polling in that area to ask residents of District 41 their thoughts on Medi-Cal. And this is what they said. They found strong bipartisan support of Medi-Cal. They found nearly 70% of District 41 residents consider Medi-Cal personally important to them or their families, including 82% of independents, 66% of Democrats, and 60% of Republicans, which is interesting. Similarly, they found significant opposition to potential changes to Medi-Cal and found that nearly 2/3 or 72% of District 41 residents oppose federal cuts to the program. And I thought this was interesting. Only 11% of those residents believe that the federal government spends too much on Medi-Cal. So generally, very supportive of Medi-Cal and the services that it provides to our community. And I'll share in just a minute in terms of its reach across the Inland Empire, but it is significant. So what is the current situation? As all of you know, many changes happening in DC right now. And with that, there are many unknowns for federal programs and funding. And that includes in the Medicaid space. There's a lot of what we're hearing. I'm going to share some of that with you today, but there's much to be determined still. In March, you might know that the House voted to adopt a blueprint for a bill that could potentially slash Medicaid funding. There have been several options that have been presented that would cut Medicaid spending to help reduce the federal budget and make up that $880 billion that they're looking to save over the next decade. I will tell you that even though the president, Speaker of the House, and others have said that Medicaid is protected along with Medicare, It's very interesting that if you look at the $8.6 trillion energy and commerce budget that will be used to come up with the spending reductions, 8.2 of that 8.6 is actually in Medicaid. So that's if you took Medicare off the table, which essentially says it's going to be very difficult for them to make that goal of cutting $880 billion without cutting Medicaid in some way, shape, or form. That's on the federal front. On the state front, simultaneously, there's also pressure on the system as well, whereas there are ballooning healthcare expenses across the state for Medi-Cal. As a matter of fact, in March, the state took out or basically, borrowed from its general fund $3.4 billion to cover those healthcare expenses within Medi-Cal. And with that, the state is now looking at, okay, what are the long-term cost savings that we can find to reduce the cost of Medi-Cal moving forward? So again, on both the state and federal side, we're seeing threats to this funding. So why do we care? Medicaid or Medi-Cal in California, and what does it provide? It provides for over a third of our population in the Inland Empire, and I'll share more numbers on that in a minute. It covers doctor's visits, hospital care, prescription drugs, mental health, substance use, dental and optometry care. You can see long-term care, in-home support, school-based transportation, and other services as well. So there's a lot of services that are covered, knowing many of your organizations might provide some of those services or might be contracted to provide some of these services. Where the funding comes from, you can see that the majority is federal. About 62 cents on the dollar comes from the feds, 22 cents from the state, 16 from local sources. I won't go through those bullets on the right side, but you can see there that essentially federal cuts would really reduce overall coverages. It could really impact long-term care, mental health, and public hospital services in particular. So we'll get into that a bit more. Looking statewide, this is who Medi-Cal covers, about 15 million Californians. That's over 50% of children. So literally 1 in 2 kids across the state of California have Medi-Cal as their insurance. About 2.2 million seniors and people with disabilities, and about 3.4 million working Californians as well. So I think many times people assume if you're on Medi-Cal, low income, might not be working. In fact, about 1 in 5 adults are working who are on Medi-Cal. And then, of course, like I said, many of those on Medi-Cal are also children. So we don't expect them to be working quite yet. In the Inland Empire, here are the numbers. You can see in San Bernardino County, 45% of our population rely on Medi-Cal. In Riverside County, it's 42% of the population. So on the whole, we say about 43% of the population across the Inland Empire rely on Medi-Cal for their services. You can see on the right there, approximately $23 billion is invested in Medi-Cal and Medicaid spending within the Inland Empire. So it's also a major economic driver for our region. You imagine if those dollars get cut, that cuts jobs, that cuts income, that cuts spending across the region as well. So not just on the healthcare side, there are also some major economic implications as well. For IEHP or Inland Empire Health Plan, many of you might know Inland Empire Health Plan is the largest provider of Medi-Cal services across the Inland Empire with about 85% of market share. IEHP does cover 1.5 million members. Like I said, that's 1 in 3 Inland Empire residents. It also supports about 9,000 providers, 855 clinics, 36 hospitals, and then IEHP directly employs about 4,000 individual employees as well. So again, as we talk about from an economic standpoint, it's supporting many jobs across the region, individual medical providers and healthcare offices or businesses, and supporting about 1 in 3 residents across our region. So one area of Medi-Cal that's really important is the treatment of chronic conditions or chronic diseases. So this is some data specifically from IEHP looking at IEHP's members, which has about 280,000 Medicaid members who require ongoing treatment for chronic illnesses. You can see that's about 20% of Medicaid membership under IEHP. So obviously, if there were cuts, it would also impact each of these conditions. So that includes arthritis, lipidemia, I'm sorry, heart disease, asthma, hypertension, cancer, COPD, stroke, and diabetes as well. I'm going to give a side note. One of the other things at IEHP Foundation that we're really interested in are the social determinants of health, which I know all of you invest in as well, particularly from a housing standpoint and others. But we know that the environment we have in the Inland Empire, that the social determinants, whether that's jobs, that's housing, that's employment, really impact these conditions as well. And another piece of that are also healthy behaviors. We really want to see increasing healthy behaviors, reducing risky behaviors. And key to that, of course, is diet and exercise as well. And we know diet and exercise greatly impact these chronic conditions. So at the same time, we know we need healthcare to address those conditions. We also know that the more we can build an environment that encourage people to live healthier lives and behaviors, the more we're going to be able to prevent these conditions in the first place on the preventative side. So, side note there for you. So I want to jump into, and this is really kind of the meat here. What are the possible threats to Medicaid and Medi-Cal right now? So I want to share a few of these with you in a bit of detail. They kind of fall into two categories. The first one is reduction in population. So in other words, reducing the total number of people who are eligible for Medicaid. The other side would be reducing the services that are eligible for reimbursement or that are covered under Medicaid for those who have that insurance. So under reducing the population, one of the major talking points we're hearing right now is really limiting eligibility based on citizenship status. So more clearly, what that's talking about is reducing or eliminating the ability for those who are undocumented to be on Medicaid or Medi-Cal. You might know this is the population that was last in, might be the first out. And so the undocumented population in California is almost exclusively funded by the state of California. It's not federally funded. It means the state of California pays for that. However, what the federal government is talking about right now is saying, hey, states, if you continue to provide services under, we call it Medi-Cal, to undocumented individuals, we're going to reduce the matching percentage that we provide for all of your residents under Medicaid or under Medi-Cal. So in other words, California, if they continue to support the undocumented population, could lose funding, not just for that undocumented population, but also lose funding for all the other populations as well that they're serving. For IEHP, just to give you a sense for what that is, that's about 10% of IEHP members. That's about 150,000 individuals in the Inland Empire. These are estimates, and they estimate about 1.5 million undocumented individuals across the state of California who are undocumented and who are on Medicaid or Medi-Cal as well. So that's something that would be significant for our region, as you can see. Secondly, the GOP in particular is really talking about the addition of work requirements. So as we know, there are other government programs that require a work requirement in order to benefit from that program. They're talking about adding a work requirement specifically for Medicaid as well. What we know is with that, even if people are working and they meet the requirements, anytime you increase that standard, it means that you're going to have people who fall off because they're not going to essentially provide the documentation to meet the eligibility. With that, something else I've talked about is increasing the frequency of people having to certify as frequently as quarterly. That would be an administrative nightmare for MCOs or for the local Medicaid insurance companies, if you will. But also it means the more frequently you do that, the more people don't keep up with those eligibility requirements and they fall off as well. So the result, and the feds know this, the result would be fewer individuals ultimately on the program, and that's how it would provide the cost savings. And the third one there under reducing the population would be changes to the ACA or Medicaid expansion. So Medicaid expansion expanded the populations who are eligible for Medicaid without getting the details on that. If they if they modified or eliminated that Medicaid expansion, then it would it would take us back to where we were several years ago, which would eliminate many adults who are currently eligible on Medicaid would no longer be eligible. Under reduction of services, one of the things we're talking about is reduction in provider taxes. And so you might recall there was a proposition on the ballot back in November for a provider tax in the state of California that made that permanent, and that was actually passed in the state of California. And many states, I think, don't quote me on this, I think it's 49 states across the US use provider taxes. And these are basically taxes where the local healthcare providers pay a tax to the state. The state sends that to the feds match those dollars and then send it back. So essentially we double our money. It is legal, it's approved by the federal government, but it's not necessarily a popular a tool, if you will, at this point. However, it provides significant dollars into the system. So one potential there is that they would reduce or eliminate those provider taxes, and that would be devastating to the system. Secondly, there's a talk about shifting to block grants. So that means rather than funding, say, the state of California based on the number of individuals who qualify for Medi-Cal, the state would get a block grant based on the total population. And why that would matter to us is because that means for states like California that have a higher percentage of individuals who are on Medi-Cal or Medicaid, which we do have a higher percentage, we would be getting fewer dollars because it would be blocked based on the total population. So the states that would benefit most from that would be those states that actually have a lower percent of individuals who are on Medicaid. For us, that's not the case. So that would hurt California. The third bullet down there, reduction to CalAIM, community sports, ECM services. I know some of you are probably providers of these services. There's a possibility of the services that have been added recently to Medi-Cal, which include what I call non-medical services. So that's medically tailored meals. There's housing supports, a number of other supports there. Those could potentially be reduced as well. Not hearing as much talk about that, fortunately, right now, but we know that's a possibility. And then the last bullet I just included was, one of the things that Jared McNaughton, CEO of IEHP, talks about a lot is that if you cut Medicaid and Medi-Cal, it doesn't just impact the low-income population. You're basically taking a major piece of funding out of the payer mix that funds the entire healthcare system. So that means the same hospitals, that you or I are going to, if we have employer-funded insurance, those hospitals will see their revenue reduced by 10, 20, 30%, which means it's going to be very difficult for them to provide quality services to anyone who walks in the doors, regardless of whether you have Medi-Cal, if you're low income, if you're higher income, if you have employer sponsored as well. And so knowing that impact, we also know that the impact to local hospitals could be great as well, because you might know there's a law that basically says hospitals have to, as particularly in the emergency room, they have to serve anyone who walks in the doors regardless of insurance. So you remove that insurance coverage, that means their population is going to increase, because rather than those individuals going to get to a PCP or a primary care physician for health care services, they're going to walk into an emergency room. It increases the number of people hitting their emergency room. Well, it actually reduces the amount of income or revenue that hospital will have to operate those emergency rooms, because fewer of those individuals will have insurance. So just to illustrate, the impact on our local healthcare system beyond just the care for those who are low income. Just to hit a couple of IEHP's policy priorities, I want to include this here to see some of the things that IEHP, the health plan, which is of course separate from the foundation, that the health plan is really focused on ensuring their members receive timely and appropriate access to quality healthcare, working with healthcare partners to provide and navigate regulatory and legislative change, developing solutions. Jared has been very involved in the conversations around, hey, how do we provide solutions for sustainable healthcare across the state? And continue to work with officials at the federal, state, and local level to advocate for the overall well-being of those across our community. So I'm going to end here. How can you respond? The biggest thing is for us to raise our voices and to make some noise around the importance of this healthcare coverage to those in our local region. There's actually just a letter, I don't have it here. There's a letter that I just saw that a couple of Republican Congress members just penned stating their opposition to cutting Medicaid, which is really encouraging. One of those was Young Kim, who hits the Inland Empire. We have a couple other Republican Congress members who have not made that taken that stand, and we really need them to. And so, in particular, reaching out to our Republican Congress members is really important. We do have a sign-on letter. You can see there on the screen that many of you maybe signed on to. We had about 90 organizations, local nonprofits, that said, hey, this is really important. And in particular says, we write to express our strong opposition to legislation that would result in significant cuts to Medicaid and or Medi-Cal in California. And so we can share that out. Melanie, I can get that for you as well. That you feel free to share that out on social media or share it with your legislators as well. Another thing you can do is educate Medi-Cal recipients, probably many of those being served by your organizations, encouraging them to speak up and share their stories. And then share your concern and stories as well. And we can do that on social media. And it doesn't even have to be saying, hey, don't cut whatever. It's, part of what's important right now is highlighting the impact of Medi-Cal and Medicaid in our local communities, and to emphasize how important that funding is. I did include two resources here. One is Health Access California. The other is Physicians for Medicaid. Either one of those websites, if you pop on there, there's a link. You literally put in your zip code, you put in some information, it automatically populates your information, and then it will send a note. You can customize it directly to your local legislators, to your representatives, or you're a constituent. And so those are some great tools, make it very easy for you. So check those out, either fightforourhealth.org or for physiciansformedicaid.org. And that's what I have for you today. If we were live, I'd take questions right now, but thanks for taking the time to watch this. Feel free to reach out to me individually. My email address is right there. And thanks for your support. Let's keep fighting the good fight. Thanks, Melanie.